Hello, my name is Chilan. My topic is heart and lung transplantation for Hcv infection donors to Uninfected recipients. Definition. Heart and lungs for donors with hepatic C viremia are typically not transplanted. The events of steroid time antiviral agent to terratime hepatic C virus. Hcv infection arises the possibility of substantial increase in the donor organ caused by inability the transplantation as heart and lungs for Hcv infection donors interested who do not have Hcv infection.
Lung transplantation and combined heart and lung transplantation is an excellent modality for patients who have got ILD, COPD, patients with cystic fibrosis, and bronchiectasis. Lung transplantation, the process is fairly simple. So as soon as the patient presents to us, we get him registered with the NOTO registry. It's a central organ transplant registry. Once the wait is over, the organ donation becomes available. Our team goes into the donor hospital, retrieves the organs from there, and then we do the transplantation. So we do single lung transplantation, double lung transplantation, and combined heart and lung transplantation, depending upon the etiology of the disease. Our patients generally stay in the ICU for a week to 10 days, and then we shift them to the ward. They stay there for at least 3 to 4 weeks, and once everything is teed up, we discharge the patient from the hospital, and then the patients are being followed up regularly and very intensively with us and with their referring physicians. So at Max Saket, we've got highly specialized team that specializes in lung transplantation and combined heart and lung transplantations, because at Max, we are eager to get you home.
Nursing application. Nursing care in the postoperative period means big individual views care following the sense clinical rise. Biopsy assigns and temperature to provide care for cheese hemodynamic, monitoring, recounting of equivalence, control, and the ventilatory regimen, aspiration or secretion, and pain management are taken into consideration.
Each year, there are about 1,900 lung transplants performed in the United States, but there's also 2,600 people added to the waiting list. There aren't enough lungs to go around for everyone who needs them. In my own experience, I know that my patients who are shorter tend to wait longer for a lung transplant. That seemed to be very much related to the fact that we try to match up donors and recipients based on how big the lungs are. Can't put a really big lung in a small chest, can't put a small lung in a big chest. Yet, before this, no one had quantified these differences. So we used a nationwide sample of 13,000 adults on a waiting list for lung transplantation. And what we found is that shorter adults do indeed experience a lower rate of transplantation. Adults under about 5'3" or 5'4" have a 30% reduced rate of transplantation and about a 60% increased risk of dying or being removed from the waiting list because they've simply become too ill without a transplant. It wasn't just an extreme effect observed among very short adults. This effect of being shorter existed across the spectrum of normal heights. For every 5 centimeters shorter someone was, the likelihood of transplant went down by 8%, and the risk of death went up by 12%. These findings are important because I think they're going to inform how transplant centers match up donors and recipients, hopefully accepting tall donor lungs for shorter recipients and getting them transplanted faster. And I also hope that it would influence health policymakers, perhaps by changing the allocation system and giving our shorter adults a better chance of transplantation.
Pros.
With It will increase the possibility of helping parity of the waiting list or urgently needs a transplant. Cons. More cases of acute cellular rejection for hysterectomy was indicated. Lung transplant recipient that is a core of patient will receive lung transplantation for donor who did not have Hcv infection.
A simple trip to the doctor turned into a life-changing event for 16-year-old Brett Wallach.
I just thought it was asthma because of just the pressure.
It wasn't asthma. Brett was diagnosed with cardiomyopathy, a condition where the heart doesn't squeeze or pump blood properly. Brett's dad, Scott, was stunned to hear his healthy son needed a heart transplant.
That's the worst, to see your own son having to go through something like that, your own child. Nothing that prepares you for that.
Brett was in serious condition and needed help now. Dr. John Nigro, co-director of PCH's Heart Center, decided to implant a revolutionary mechanical heart.
That pump really helps make sure that there's adequate blood flow to the body and a blood pressure, but it also reduces the workload that the heart has to do.
Brett was the first patient at PCH to go home on the device, thanks to their cutting-edge technology.
This device is really relatively unique because it allows him to be at home and do all the things he likes doing while he's waiting for his heart transplant.
And just 12 weeks after that initial doctor visit, Brett got the call. PCH had a heart for him. The Valley's only pediatric transplant team successfully implanted Brett's new heart.
Their loved one paid the ultimate sacrifice, so he's going to go on to do great things to repay him.
Updates in Ecuador. The earthquake now mentioned Ecuador and looking for information. It seems that this type of translation has not been practiced, but in whole benefit use seems the translation are in and desert and is a matter of intention due to lack of information to censor. This type of information will help to break taboos and create a chance of like to those we need is those excuse. Conclusion. Expecting we hope Hcv infection will raise a heart or lung transplantation for donor with hepatitis C viremia, the active with an antiviral regimen for 4 weeks into the with a fair heart after transplantation prevents the establishment of Hcv infection.
Up until my transplant, I spent my time doing my artwork. My art really helped me to be able to express myself. When I was in the intensive care unit, the group effort of all the specialists and doctors at Penn was wonderful. There must have been close to 50, 60 people all told that took care of me. They never gave up on me. Penn gave me hope.